Hi guys, this is Doula Jana with Yuma Mamas, and I want to talk to you about what the difference is between a doula and a midwife. I get this question often because both of those words are a little bit strange in our culture and time, and so we don't really understand the difference of what those are. A doula is a non-medical care provider for birth. So she gives emotional, physical, and informational support to couples throughout birth or pregnancy and birth and postpartum. So the key though is that she is not a medical provider. She's not trained in medicine. But she is a servant and a helper. And there's another video you can go watch where I describe fully what a doula is and what she does so you can understand that better. However, a midwife is a medical care provider for birth, and she will do prenatals throughout pregnancy. She might work at a hospital, she might work at a birth center, she might work at home. So midwives can work in all of those contexts, and their specialty is normal, low risk birth. So if you are a healthy woman and you have a healthy baby and you are planning to have a natural birth, then you can use a midwife. A natural birth doesn't necessarily mean an unmedicated birth. There are hospital midwives who will care for women who have medicated births, but it still would need to be a natural or vaginal birth. The midwife does all of the medical care, so she's just like a doctor. She's trained like a doctor, so we use the word doctor for medical things, but midwife is really a doctor for normal birth. And if for some reason there's any complications that arise in your birth, she is backed up at hospitals. She's backed up by an OB or a doctor who specializes in complications or high-risk birth. And if you have a midwife out of hospital and you end up experiencing complications at a birth center or a home birth and you're needing specialized care or even cesarean surgery, then you would transfer to the hospital to use OB care there. So that's the key with midwives. They are for normal, low-risk births, but they are a medical care provider, whereas a doula is not a medical care provider. They can be with you in any type of birth, in any birthplace, any location, but they're there for emotional, physical, and informational support only for the couple. I hope this video was helpful to you. If you have more questions about the roles of those people, please comment below or look at the links in the descriptions for other videos.